Hello, it is Tuesday the 11th of February, which is the founding day of Japan, whatever that means. So it's a public holiday. So I thought I would just make a quick video for you, just updating you on my situation. Lots has been happening, nothing like hugely promising in itself, but hopefully I'll start making some progress soon. So the first thing is my liver is recovering after the surgery last month. I had 2 surgeries for blocked bile duct, and I had kind of partial liver failure from the blocked bile duct, and recovery has been very, very slow. Typically, if you have liver failure from a blocked bile duct and you successfully have the surgery to put in a stent, you'd recover pretty much 3-4 days, maybe a week at the most. But yeah, for me it's been 4 weeks now. My liver's still not normal levels like of liver function, but it's improved, and significantly it has improved enough for me to start chemotherapy again. This is my first cancer treatment for possibly 3 months now, I think. So I started chemotherapy again yesterday. There was some an issue that I may not have been able to have the drug that helps the immunotherapy work, which is called Avastin. It's a very important drug because the chemotherapy is third-line chemotherapy, which means it doesn't work particularly well. And when I had the surgery in January, the surgeon noticed there was a stomach ulcer near my duodenum, and when you have a stomach ulcer you generally can't have this drug Avastin because it can be fatal. But I went to see the surgeon. I got the report from the photos of the gastroscopy, which is where he had examined my stomach with a camera. I took those photos to my oncologist. He read the report, looked at the photos, and decided it was safe enough to do Avastin. My oncologist had been a gastric surgeon before, so he was very able to judge about the stomach ulcer. So that's good. My weight is still a bit low. I've been trying to build up my weight over the past month since getting out of hospital. Struggling to eat, and it's it's just every day trying to eat what I can. And now I have put on a couple of kilograms. I'm trying to exercise as well, because being in hospital for 3 weeks I was in bed almost all the time and not eating, so I lost a lot of muscle. Well, I didn't have a lot of muscle, but what little muscle I had I lost. So I'm trying to get strong again. That's going to be a real challenge from now on because I've restarted chemotherapy, and one of the main side effects of this chemotherapy drug called Lonsurf is appetite suppression. I am in pain all the time from the cancer, although now I wonder if also some of the pain is from the stomach ulcer, which would be kind of good news because the stomach ulcer will heal up over time. I'm taking an anti-acid medicine every day called Tacacab to protect the stomach ulcer or protect the lining of my stomach from further damage. So hopefully the stomach ulcer will heal up over time, although of course healing is slow because of chemotherapy and because of this drug Avastin. So I'm in pain because the lymph nodes with cancer in, they're kind of swelling up and pushing on areas of nerve tissue, and there's some liver tumours. There are now 3 liver tumours, and 2 of those are in an area where there's a lot of nerve tissue in my liver. So because I'm on pain, and because I'm in pain, I'm on 24 hours a day pain medication. So I'm taking fentanyl, just that one that kills all the people in America. I'm taking a minute fraction of what they would take, obviously. So I have some skin patches, fentanyl skin patches that release a total of 4 milligrams over a 24-hour period. And then I'll also have another opioid medicine I can take when the pain gets worse, which it doesn't really. It's more of like it just reaches a point where I need a pain medicine. So fentanyl and this other opioid. So fentanyl is an opioid, and I've got this other opioid, a Japanese one, and they have side effects, like they muck up your digestion, so that's unpleasant and uncomfortable. They cause a dry mouth. They cause you to be very drowsy in the daytime and unable to sleep at night time. I take a couple of tranquilizers before bed that really helps a lot with helps me to sleep, get to sleep, but also if I do wake up in the night, kind of helps to prevent me getting stressed out about trying to get back to sleep. So that's good. So as I said, I started chemotherapy again yesterday. It's the same chemotherapy I had before, Lonsurf with Avastin, but the dose of Lonsurf is reduced because of poor liver function. So it's not particularly effective, really. So it's a protocol where you have a drip on the first day, which is the Avastin drip. Bevacizumab is the generic name for Avastin. And then you take the chemotherapy pills in the morning and evening for 5 days. You have a 2-day break from the pills, and then you have the pills for another 5 days, and then the Avastin drip again, and then you have a 2-week break. And the side effects tend to be worse in the 2 weeks. So during the sort of 12 days of pills, with the 2 days in between, your body is kind of getting the maximum chemotherapy, the maximum of this chemotherapy that you can sort of tolerate, and the side effects are ramping up: fatigue, trouble sleeping, appetite suppression, gastrointestinal issues, numbness in your fingertips, skin trouble, all the usual chemotherapy side effects. So then you've got the 2-week recovery period, but the side effects have continued to ramp up for the first few days of that. And that time is when there's the maximum bone marrow suppression, so you're really low on energy. Your white blood cell count's low, so it's easy to get sick. So that's what's been happening. Unlike regarding treatment, which I'm finally starting some cancer treatment again, which is very good, even though the side effects are tough and it's not great treatment. But I'm still looking for treatment options. So one thing I am looking into is there's a small possibility I may have a genetic mutation called HER2 if I have that mutation, then I could potentially treat the cancer with a drug called Herceptin. It's a monoclonal antibody, and it's HER2 is usually associated with breast cancer, so that's a drug that maybe breast cancer patients will have taken, although there is at least one other drug that's now kind of a replacement for it, I think. But it's potentially a treatment option. I did a protein test for HER2 and that came out as positive. But that's not enough to justify trying out the drug. I do need a genetic test as well. That protein test is like testing the blood plasma and seeing if HER2 protein is there, but whether it's there because of having that mutation or not is another matter. And when I had that test for that genetic mutation in 2018, it came negative. But I've read that sometimes colon cancer patients, because of the treatments we have, we get that mutation forming. So to that end, I've had the liquid biopsy test again. So this is a genetic test where they check for a certain number of mutations. This one is the Guardant 360 test, which tests for about 100 mutations. I think about 100, and it will take a few weeks to get the results back. Genetic testing takes a long time in a clinical setting. In a research setting, it's very quick. You just put the stuff in a machine and 30 minutes later spits out the answers. But in a clinical setting, to make treatment decisions, there's a lot of manual steps, double checking. There's a lot of safety stuff that has to be done. Everything has to be manually checked several times. You have to split samples and do the same test a couple of times, and so that's why it takes like weeks. So hopefully in a couple of weeks' time, I'm just sort of glancing at my list of stuff to talk about. A couple of weeks' time, possibly through 3 weeks' time, I'll get the result of that genetic test. It's the same one I did in 2018. In 2018, it found 3 mutations, but as I've had a lot of new cancer since then and a lot of cancer treatment, it's possible some new mutations may have appeared. I'm desperately hoping that HER2 would be one of them, because that's like an actionable mutation where you can have a treatment based on it, which would be good. I'm also doing a solid tumor biopsy. So I've got 3 tumors in my liver, but they are in places that are difficult to get to for a biopsy. I could have a lymph node biopsy. That could be done by the surgeon who did the bile duct surgery. He can use the same kind of procedure to take a cancerous lymph node. It's a procedure called ERCP. That's less invasive than kind of surgery, but the problem is with that, the volume of the sample you get is small and would probably be too small to do good genetic testing on. So what's kind of left is I've got a cancerous lymph node. Just looking at the screen, I've got like a bunch of cancerous lymph nodes under the left part of my collarbone. So I met with a surgeon last week, a head neck surgeon, at my hospital, Tokyo Medical Dental University Hospital, and he said he can cut out the largest lymph node and send it off for the biopsy. And I kept thinking in my head that this is a really small procedure, and it's not. It's a surgery. So there is what's called a needle biopsy, which is where you using ultrasound, you guide a needle into a tumor or into a cancerous lymph node and suck out some tissue. But the volume again for that would be kind of small, probably too small to do reliable genetic testing. So this is why I'm having this tissue biopsy, and I just kept thinking of it as this small, simple procedure, and it's not a. I mean, it's straightforward, but it's surgery. I'll have a general anaesthetic. The surgeon will cut out this lymph node that is maybe, I don't know how big it is, but maybe a normal lymph node is maybe 10 millimeters. This may be like 15, 16, something like that. So I'm going into hospital. It's 2 nights in hospital to do it. The surgery itself is about 30 minutes. So I'm going into hospital a week from today. So next Tuesday, going to hospital. For some reason, you have to go in the morning. So I've got to be at the hospital 10 o'clock in the morning. It's an hour and a bit from my home, which is a bit of a challenge for me because at the moment I'm getting drug-induced sleep, and yeah, so got to get up, get on the train, get into hospital, and then the whole day sitting around doing nothing in the hospital. Do surgery the next day, 30-minute surgery. So rest of the day kind of sitting around. Because it's Japan, they keep you overnight for another night of observation. And then finally get to go home Thursday morning. So yeah, quite a performance. And yesterday I saw the surgeon again to do what's called the informed consent. So he was reading through it's like a 15-page document for this surgery, and it was getting scary, like hearing about all the potential side effects and issues. Now the chance of them happening is very low, but it's still scary when he's saying like, oh, he has to cut some nerves to get to this tumor, and it's close to like the nerve that lifts up your arm. So in a really bad situation, that nerve might get damaged and you wouldn't be able to lift up your arm anymore. Obviously it's in your neck, so it can you might get some issues where stuff affects your windpipe and you'd have to have a tracheotomy to live. Might get fluid in your lungs and all this. Like I was yeah, it was scary. Hopefully it's going to be very straightforward. Yeah, but we'll see. And all that is to get a little bit of tissue to then do some probably the same or similar genetic testing. But it will be good because although it's unlikely to reveal anything particularly useful, some clinical trials are one of the requirements of getting in is that you've got a recent tissue biopsy, and I don't have any tissue. The most recent I've got is 7 years ago or something. Yeah. So that's next week. The week after, I'm having some immunotherapy, thanks to your recent donations. I really, really appreciate that a lot. So that immunotherapy will be in the break between the current chemo cycle and the next one. So hopefully it will help a bit. and I'm still trying to get into trials. So I was due to start a trial in early January, and 3 days before the date to go for the pre-trial checks, I had the bile duct blocking up with cancer, so I had to do the emergency surgery. So I missed the chance of getting in that trial at that time. It's possible I could get into that trial later on. It's going for, I think it's going till the end of the year maybe, and they're recruiting a few patients each month. So it's possible I could join it in maybe April. I couldn't join it next month because when you get a place, you then have to wait a certain number of weeks for your current treatment to kind of wash out. It's called the washout period. And in the case of Avastin, that's 4 weeks you've got to wait. So the earliest I could do it is probably April. But there are other trials around too, possibly, that I may be able to do. There's a promising one called the CMET trial, which is a type of chemotherapy that's targeted. It's got like a delivery system that the chemotherapy drug is covered in some kind of protective shell or some molecule that makes it inert, and then when it gets to the cancer cells, when it gets into the cell, the cancer cells are acidic, and that breaks off the protection, and then the chemotherapy drug kills the cancer cell. The idea being that you get very little chemo in the healthy cells, and the chemo can be some more potent in its effect because it's being delivered to the cancer cells. So that trial has been it's been going on for sort of 4 years now. I've found out. I don't know if they're still recruiting. They often just recruit a few patients a month, so it's possible. So one of the doctors is looking into that. One other thing I'm looking at is radiotherapy. So there's a type of gentle radiotherapy called tomotherapy. So if the current chemotherapy and the immunotherapy I'm doing, if that gets things under control a bit, then I may be able to do the radiotherapy, which would shrink, hopefully, the liver tumours and some of the cancerous lymph nodes, and that would have no real effect on the cancer, but at least temporarily it would reduce the pain. And reduce pain means I could get off the fentanyl or reduce the dose and have a better quality of life. So that would be really good. People always ask me what they can do to help. Sharing the donation link is obviously a big thing. But if you can subscribe to the YouTube channel, that's really helpful. If you can click like on the videos, that's really helpful. But one thing is, if you can just write a question as a comment, that's really, really helpful, because it when questions come in, it makes it really easy to do videos, and the videos I think are useful to other cancer patients, and hopefully it's interesting for you to hear my answers. So if just right now, if you just post a question, obviously look at what other people posted so you don't put the same question as them. But if you could post a question wherever you see this video, that would help me a lot. More videos coming soon, and thank you so much for your support.